Hello, everyone. Welcome back to this year's CR Arthritis event. I'm Kelly Lenvoy. I'm the VP for Communications and Public Affairs at Arthritis Consumer Experts. And today we've got the privilege of talking to the team behind a workshop presentation, a very important one, titled Towards Improving Representation in Rheumatology Research in Canada and Beyond. And joining us today are Dr. Mary Vera, an assistant professor in medication adherence, Faculty of Pharmaceutical Sciences at the University of British Columbia, Megan Thomas, PhD student at the UBC Department of Pharmaceutical Sciences, Anna Samson, a person living with ankylosing spondylitis and fibromyalgia. She's studying English at McMaster University and is an advocate for disability and mental health. And we're hoping a fourth member of the team, also in Winnipeg, may be joining us, and that's Michael Keleva. And he's an arthritis patient and advocate for over the past 10 years. Team, welcome to the show.
Thank you for having us.
Of course. So representation in arthritis research. It's a topic that ACE has spoken and written about, and our audience may have some familiarity with. It's obviously a topic of most importance to patients, and it's also one that's evolving. Really interested in finding out about your workshop, the objectives for your workshop. Maybe as a start, you can share with our audience, what is it you mean when we talk about representation in arthritis research?
Okay, I can start with this one. So when we talk about representation in research, there are a lot of different factors that we're trying to think about. So I think some of the obvious ones that we hear about more often now are things like sex and gender, but we also want to have more racial and ethnic diversity. We want more individuals participating from different socioeconomic backgrounds, from different provinces. And then thinking of conditions as well. So are people with different inflammatory arthritis types being considered in the types of research we do, or are they kind of more focused on a dominant condition? So representation is very broad. And I think the reason we really wanted to dive into it is the work that we've been doing so far, looking at the research that's done in Canada. Typically, we have the same types of people participating in studies. So we're trying to see what we can do to change that so that we have research that represents the population with these different conditions, because we know anecdotally that it isn't very representative right now.
And so, Megan, would sort of traditionally the people involved in research kind of look like me?
Yes, if you were female as well.
So predominantly a white population,
Yeah,
and
yeah,
not
predominantly.
at all reflecting what Canada really looks like.
Exactly.
It's interesting. I think, you know, a lot of fault lines were exposed during the pandemic, and I think certainly our audience may be aware of one of those that was exposed, and that was this very topic. It was not necessarily Canadian research, but it was the experience in the United States. And what we found there is that there was a very small percentage. I think it was, Mary might know the numbers, but I think it was about 10% of Black and Latino population that were involved in the clinical research studies around the coronavirus and vaccinations. But actually, more than half of the people who had coronavirus cases came from that population. So a huge imbalance there. And certainly a weakness in the process that was discussed during the pandemic, and I think is now being addressed not just in the United States, Canada, North America, but around the world. One of the questions our audience might have is, what type of research are we talking about? So I just mentioned clinical studies, and I know that's a very important one, that underrepresentation in clinical trials. but maybe you could explain to us, it's not just clinical trials, but the importance of clinical trials. Maybe just walk our audience through that.
Sure, maybe I can take this one.
Mhm.
So, I mean, the underlying motivator for this work is we do use research, or research does inform future interventions and treatments, and we want to make sure that research is representative of the patient population. So we are finding that clinical trials are largely conducted among mostly whites, most of a certain age, of a certain sex, then we really are missing the opportunity to make those findings relevant to the entire patient population. So we've actually done a number of studies actually looking at Canadian research to date and in rheumatology, and who are participants in this research, and what data they're collecting on what we call factors that lead to health inequities. And we've done this work in rheumatoid arthritis. We've also done it in juvenile idiopathic arthritis. And we actually just had a paper come out last week. And we also replicated this work in lupus. So, and consistent across the Canadian research to date, and these are clinical trials in these conditions, we do find that participants to date have largely been white, female, and middle age. So it really is a call to action to have better representation in clinical trials. But we really wanted to expand that, because I also think about the other types of research that we do, qualitative research, observational studies. And I think while we haven't systematically summarized these findings, I think anecdotally and looking at our own, I've reflected on the research I've done in the past 10 years. It has not been representative. So I think there's also been self-reflection across all range of research approaches.
We've done a lot of work in our national survey program,
Mhm.
and this came out of the pandemic. And ACE has conducted national surveys on various topics, including health inequities. And one of the subset analysis we've done is to look at BIPOC patient populations, Black, Indigenous people, and people of color.
Mm.
And I'm wondering specifically about Indigenous peoples. Um, Obviously, they would be part of that underrepresentation. Are we addressing this topic as it applies to that patient population?
So the future work that we'll do, that we are going to be doing when we involve patient recruitment, we are going to hopefully be addressing it across the BIPOC spectrum. It's not going to be targeted per se, because when we've spoken to our patient research partners, we don't want to just do a certain population, because we really do want the research to be inclusive. But recognizing that, we do understand um, the that there are certain approaches that we need to take to be able to do culturally sensitive research. So we're actually partnering with other researchers who are experts, say, in Indigenous research, and also partnering with organizations so that we make sure that our work, when we get to patient recruitment, is culturally sensitive. But we are going to be targeting or approaching all cultures, all races. And because we want to represent everyone. So, and I guess, I put my BIPOC hat on. We're thinking about the approaches to the Filipino community. Megan and I've talked about approaches to the South Asian community. So we really want to be all inclusive in our work. It's very ambitious, but we have to do it. And yeah.
Well, I think ACE, particularly driven by our president Cheryl Cohen's commitment to this. That we
Yeah.
look forward to being partners with you as this advances. Now we've talked a lot about gaps and challenges. Let's turn this over now to looking at the benefits. What are the positive outcomes that are going to come to us if we address this underrepresentation, and we're actually conducting research that reflects Canadian society? What are the benefits for patients going to look like?
I could kind of jump in for this.
Sure.
So for a bit of context, when I was first diagnosed with ankylosing spondylitis, I was told that this is typically a condition that affects white men, and that's about all I was told about the condition. And I was like, okay, why do I have this then as, you know, a like person of color? And I found out like years later after getting more involved with research that this is because there hasn't been research done with people of color, with women, with gender diverse populations. It just hasn't been done. So when patients are diagnosed, they're not told about how common it is for their like identity groups, because the research hasn't been done, so they don't know. But the research has only been done with white groups, so that's what the understanding is, not just for patients, but that's the understanding that rheumatologists have as well, that other researchers and like scientists have as well. So to aim for greater representation in research means that, other patients that are newly diagnosed can get more accurate information about their identity groups and what that means for them, how like the likelihood, the risk factors for their like ethnic groups or for other identities that otherwise they wouldn't really know. And rheumatologists can also only share as much as they know, as much as the research allows that they've learned. And if they aren't given access to information that is inclusive, they can't provide inclusive care to patients. So that's one way we're hoping that this will benefit like everyone involved in rheumatology, not just patients, but those providing care as well.
I think this is very inspirational, aspirational for patients to hear. And I think it will inspire them to participate, to want to get active. How does a patient do that? Who do they talk to? Who do they go to get more information and to be involved in research?
In my experience, I started volunteering with different organizations for some of the conditions I have. So I started volunteering with the Canadian Arthritis Patient Alliance, and in different aspects, writing some blog posts for them, or participating in some of their events. And then anytime any research opportunities came about, they let me know and they put me in contact with other people, and they even acted as a buffer or a representative where I needed help if I wasn't sure where to start, especially because I studied English, and before being diagnosed with these conditions, I had no knowledge or experience of these conditions. I felt really in over my head. So a lot of times, like patient-led organizations that support patients can also support them in getting involved with research and provide them with, different resources that can help them feel more prepared to be a part of research.
Would they also be able to go to, let's say, the university where you work
Okay.
and find out information about how to get involved in
Oh,
participate in research?
so yeah, so right now we don't have an active study where we're recruiting patients, but we are always looking for patients who could give us feedback on the work that we're doing. So partnering with patients as patient research partners. So to do that, I am very active on social media. My Twitter handle is at Mary A. De Vera. And then we also share a lot of our study on the Arthritis Research Canada website. You will actually see links to papers that we have published on this topic, as well as infographics. And when we have a study that will be actively recruiting patients, we will also be putting the information on the Arthritis Research Canada website. But as I mentioned, if there are individuals from underrepresented communities that are looking to get involved. We are looking for patients to tell us how we can engage with your communities, because we really, again, going back to that, we really want to make this work all inclusive.
I guess the final question is what I think we sort of have a sense of what progress will look like. But what mechanisms do we have in place to measure progress so that if it's not advancing as fast as we would like, is there ways, and if we're all sort of advocates and part-time advocates in the work that we do, how are we going to measure that? And what's in place right now to be able to do that?
So I think back about my own work. So again, in the last 10 years of doing research, I will admit my early work, or in the work that earlier work, has not been very representative. But in recent years, when you do look at who's participated in my study, I am proud that I think we are getting better representation. I am the first to publish. We always look at our participants' race, the age, the sex diversity. In arthritis, it is there's a preponderance for more females than males. So actually, in arthritis, if we get more male participants, that is actually something we can measure as a step towards better representation in research. So I think I think research has given us the tools to be able to measure, and we can even look at like each study if participants are more representative of communities. I think we're getting towards that. And I think the other thing we can look into, because we hope to engage these, is also funders. So we want to engage with Canadian Institutes of Health Research, with the Arthritis Society, to work with us and to work with researchers to make us, I mean, for lack of a better word, I think to push forward research, put these mechanisms in place to demand better of researchers, and that better is being more inclusive. I wanna I guess speak to, on Friday, Megan will be presenting a study where she has, why don't Megan talk about it?
Sure. So I was able to conduct interviews with researchers and rheumatologists in Canada, really to explore this topic and to look at how or if they have been able to consider representation in their work through, this movement of equity, diversity, inclusion. I think a lot of people know those terms, but we wanted to see, based on, the reviews of work that we've done, it's not very representative. So we wanted to see what their thoughts were. And so really the findings that we had were different barriers to doing this, but also some ways that we could support researchers. And I think Mary spoke to a really big one, is getting funder recognition and support and being able to incentivize people to do this work. Because I think across the board, at least the people I was able to interview, they all think it's important and valuable, and that we're not going to advance the field by not looking into this, but it can be a lot more challenging. Just thinking of doing this work well, it takes more time, it takes more money, it takes more support. And to be able to reach these different underrepresented communities, I think we need to put in that effort. And that usually comes from having more money and time to be able to do that. But yeah, so hopefully it'll be something that we have more on the forefront of our minds as we're doing this research. I think even just the fact that Mary is talking about looking at her own work and seeing the progression over time, I think a lot of people are beginning to do that now, and it seems to be a lot more intentional. So hopefully that will be a good way that we can measure it going forward.
One thing that came out from those interviews, and I that quote is stuck in my head, and I think we're going to be using it as a title for a lot of this work. One of the people that participated said, "It's just good science." So it's good to do. It's good societal responsibility, and it's also good science. So we should be doing it. I mean, yeah.
It's just good science, and it's about time.
Yeah, exactly. We're gonna add that to our tagline. We're gonna take that from you, Kelly.
I think, people have heard me say this, that one of the really powerful benefits for us to participate at the annual meeting, and for me, it's really personal, is to get to meet the next generation of leaders in the community. The icons and the established leaders, we owe them a lot. But if we're going to take arthritis to the places where we want it to go and for it to get the recognition, I think you guys are talking about that kind of recognition. It's really up to that next generation of leadership. And I think today was a great example of that. You're a tremendous team, and your work's really exciting. I congratulate you on the research and raising awareness while you're in Winnipeg, and obviously everything that you're doing when you go back home. So thank you very much for joining us today. I know it's probably a busy time in Winnipeg, and I'm so glad you had that in-person opportunity to meet all the team together. So thank you very, very much for joining us today.
Thank you for having us.
Thank you.
And thanks, of course, to our audience for being with us today. Thank you for joining us. Bye-bye.